the UN is fighting back with education like this school in India, which tries to provide schooling to the very young, hopefully to give them a chance later in life. But it's a lucrative trade, and the UN is sometimes forced to even fight the battle with governments, all too keen to turn a blind eye to this profitable form of abuse. It often has no symptoms and there's no known cure, but this genetic heart condition can claim a young life in an instant. 15-year-old Colin Dolder has had hypertrophic cardiomyopathy, or HCM, for 3 years. It's a disease that causes the heart's main chamber to enlarge, making it vulnerable to life-threatening rhythm abnormalities. Dr. Barry Maron of the Minneapolis Heart Institute is trying to raise awareness of the disease that affects 1 in 500 people. He also discovered that hypertrophic cardiomyopathy is the leading cause of sudden death among young people and even among trained athletes. Only an echocardiogram can give complete pictures of the heart, showing problems that would normally be missed. While some HCM patients live normal lifespans without symptoms, the disorder can cause death or disability, especially among those who put extra strain on their hearts. Colin's mum, Connie, was shocked that not only was her son sick, but he had a relatively common disease that few people had ever heard of. In some cases, a heart transplant is the only option for HCM patients. Others can be treated with medication or implantable devices. When a heart stops, a race against time begins. Paramedics struggle to keep the victim alive long enough to get to a hospital. But with a survival rate of 5% or less, the odds are stacked massively against them. A recently published study shows that a drug called amiodarone can double the patient's chances of getting to the hospital alive. When a person goes into cardiac arrest, the first response is cardiopulmonary resuscitation, then defibrillation. But if by the third electric shock the heart hasn't returned to a regular beat, the standard procedure is to inject the drug lidocaine. While amiodarone has more chance of getting a patient to hospital alive than lidocaine, it's harder to administer, with the paramedics having to prepare an IV on site. And even if a patient does make it to the emergency room, amiodarone doesn't raise their chances of getting out alive. Another study in the New England Journal of Medicine has shown that ice packs used to chill the bodies of cardiac arrest victims will dramatically reduce neurological damage from stroke. Scientists are advising that ambulances should carry ice packs to be placed on a patient's body immediately. Applied in time, the cooling can improve their chances of surviving with little or no neurological damage. The findings from Australian and European researchers in 2 separate studies offer an inexpensive new tool to help the millions of people who suffer cardiac arrest worldwide. While CPR or a defibrillator can restart the heart, a series of brain-damaging chemical reactions may have already started if too much time had elapsed. Doctors at Duke University Hospital in North Carolina have already noted many positive effects of the cooling technique. If the heart stops beating for more than 5 minutes, brain damage or death is very likely. But lowering the body temperature to 92 degrees Fahrenheit, 6 degrees below normal, is considered the optimum temperature. Of the 1.1 million American heart attack victims each year, only about 20% get to the hospital in time to benefit from the latest clot-busting medication. Non-invasive prevention implantable. These were the buzzwords at a recent meeting of the top minds in cardiac care. Among the advancements in the research into the world's biggest killer, heart disease, is a new drug-coated stent that's proven 100% effective. Surgeons can now combine balloon angioplasty with stainless steel stents to prop arteries open. But the body builds scar tissue around the stents, causing it to reclog, a process called restenosis. The new stents stop this from occurring. The drug-coated stent is not approved by the FDA yet, Researchers are still working on ensuring that the drug coating is not rejected by the body. Another bit of high-tech help for the heart is a combination defibrillator and pacemaker in one. Research on the FDA-approved InSync shows positive results. These patients have faulty wiring in their hearts that causes abnormal rhythm. The condition is usually fatal within 5 years of diagnosis. The InSync not only regulates the heart's rhythm, it also shocks the heart if it beats irregularly. Studies showed that those with it survived longer and had a better quality of life. Japan's snow monkeys have known for ages the joys of a hot outdoor bath in the middle of a cold winter's day. But now people from across the globe are discovering the same pleasure in Iceland. The Blue Lagoon is an outdoor spa created from the runoff of a geothermal power plant. Never mind that the temperature outside is below freezing, the warm waters in the lagoon average a comfortable 100 degrees Fahrenheit. But these waters offer more than a pleasant excursion on a cold day. The lagoon's mineral content is known to cure common skin ailments like eczema and psoriasis. According to scientists, the unique ecosystem of blue-green algae and silica mud coupled with the location's unpolluted surroundings form the treatment's foundation. The medicinal attributes of the water were discovered by chance. Today, the lagoon runs a skin therapy outpatient clinic. Treatment for psoriasis takes about 4 weeks. The cost for Icelanders is covered under the country's national health insurance. The price for foreigners depends on the length of their treatment. A daily visit, excluding special treatments, costs about $80. However, most of the people who arrive at this oasis don't come for treatments, but rather to be treated to an afternoon of relaxation. There's nothing like it. That relaxed feeling is shared by many. Last year, 315,000 people visited the lagoon, more than the entire population of Iceland. In the South Pacific, where it's grown, kava is considered the drink of the gods. The root can help people relax, de-stress, and ease pain. James Adelson has used the kava that he sells in his New York City store to deal with anxiety. But kava is coming under increasing scrutiny by regulators in the Western world, where researchers have linked the herbal remedy to over 24 cases of hepatotoxicity or sick liver condition. Several people have needed liver transplants, and one person died after using it. Dr. Roberta Lee, the medical director at the Center for Health and Healing at Beth Israel Medical Center in New York, has studied kava extensively. She believes the problems arise when it's processed into capsule or liquid form. Already Australia, the United States, Canada and some European countries are warning people about kava. Kava products have been withdrawn from many store shelves in the UK. The Swiss have banned them and the German government is considering making them prescription only. According to Dr. Lee, this action may be slightly hasty, considering the side effects of kava are as dangerous as those from prescription anti-anxiety drugs. Locals in this small northern Nicaraguan community picked the small flat leaves from the tamarindo tree for their medicinal value. The popular remedy known as fresco de tamarindo is said to cure disorders like inflammation and digestive problems. A native to tropical Africa, the tree spread to the tropical areas of the Americas and West Indies. First, the leaves are ground into a fine pulp. Then they're steeped to release the plant's medicinal properties. After the leaves are strained, the juice is ready to drink. It can be used to treat fevers and as a gargle for sore throats too. The pulp, which is dried and packaged, can also be sprinkled into food, as it's known to help those suffering from stomach upsets. Locals swear by the medicinal properties of the tamarindo tree and say it's as effective as Western drugs, which are either unavailable or out of the financial reach of most of the residents of this small community.